Dr. Piskin, let's talk about dentures. Lots of people come in after many years after a few years wearing the dentures, and then they go, the denture broke, the denture doesn't fit anymore, and they somehow blame the denture of maybe not having been made so well, when it really is that their bone char is shrinking, and it's almost like you buy a suit and then you put on 20 pounds. It wasn't the tailor which did a bad job, it's you grew out of it. Opposite way in this case. But tell us, when people come in with such a case, these days with new technology and stuff, what can you do for them? Shed some light on it.
Well, you're absolutely right that if you don't have something stimulating the bone underneath the dentures, the bone will get eaten away. We call it resorb and disappear. And then the dentures get loose and they slip and they fall and the patients are miserable. And over time, more bone gets lost. So then they think that their denture, something happened to it, but it's really that they're losing their bone. But if we can today replace with something that's going to stimulate that bone from not disappearing, like the use of dental implants to help hold in a denture or snap in a denture or to totally replace the denture, then the bone stops disappearing. So today we have choices to help those patients. So sometimes you can have a denture patient, you can put 2 implants in, and then we can make a denture that snaps in. And that stays in beautifully, and it's amazing, and they're so excited. They can finally chew their food, and it doesn't slip, and it doesn't break, and it doesn't slip while they're speaking, and they don't get embarrassed. Or sometimes you can put in more than 2, and maybe not even have the denture have something covering the palate. They can taste their food better. They don't have anything in their way of their tongue. They can speak better, and it stays in. It's amazing. So the use of dental implants today is even used for people with dentures, even if they don't want to get rid of the dentures, but just to keep the bone from disappearing anymore.
So for a lack of my better understanding, you created a hybrid. Like you have a denture and you have an implant, you mix them up, and by doing so, you drastically improve the functionality of the denture by it doesn't sit on the gum anymore, so it doesn't rub and hurt. You can taste the food better, and something very important, you said it sits more firm, so you can actually chew better. You're not worried about it falling off. And what about the bone shrinking? Now that you put in a couple implants or 2 or 3 or whatever it might be, will they shrink less also now?
Much less. When you're stimulating the bone, it has something around it, whether it be a tooth or a root or an implant, then the bone's not going to disappear and shrink anymore significantly. Years ago, we used to keep roots in so that the bone wouldn't disappear. But today we have dental implants, and we can really use them well and put snaps. And just like a snap on your shirt, on a blouse, one part goes in the implant, the other part goes in the denture, and when you put the denture in, it snaps in, and it's so difficult to really take it out. Once a day, you take it out to clean, and it really feels like your own. And patients are really appreciative, and they feel very secure with everything they do in their lives now. They can go out, they don't have to just worry about getting a little piece of fish, small pieces. They can actually get a steak now. They can actually get some spare ribs and not worry that the denture is going to click out and fall out. And you can invite them to the barbecues now, and they're going to be able to eat their corn on the cob. They're very happy.
Beautiful. Let me ask you, Dr. Piskin, so if those people come in with that denture which kind of didn't fit, and you do this, what you just said, this hybrid, this, snap on you, so you place implants, are you going to use the denture that people had, or do you need to make a new one, or is it depends on how bad it was damaged or whatever already before? What's the deal there?
I think it's all those things you said. If it's badly damaged, you don't want to use the old chassis of an old car if you're getting brand new tires and you're getting a new interior. But yes, sometimes you can use the denture if it's in good shape, the teeth aren't worn down or broken, doesn't have a history of having it been cracked or fractured. And many times you can use your existing denture and convert it to accept the new snaps on the implants. But many times it's the patient will like to have something new. They don't like the way the smile looked, that the teeth are broken or too short or they're too old. So it's a combination. It could be any of those things. Yes, you can use your existing.
I got it. So So let me ask you something.
Okay.
So a person who wears denture for a long time or has many other missing teeth, and you said that, the gums are shrinking, is that why my grandma and anybody who would do that now kind of looks like a dried out tomato, like caved in face and stuff? So are you telling me that a good dentist, by putting in implant, preventing the gums to shrink, the bones to shrink, keeps the mouth full, and by doing so, you guys are actually plastic surgeons, no more Botox needed or something like that?
Well, I don't know about the Botox part, but if you're going to have shrinkage of bone that supports everything, then the outside of the face is going to follow that shrinkage, and you're going to look like you have more of a sunken face. You're going to get more wrinkles. The distance between your nose and your chin is going to be squashed. Your lips are going to be more like that. But yes, if you do the right thing and preserve your bone and replace them with the proper things, in this case, if we're talking about implants, you can make the lips and the face look much younger looking. And when they smile, they'll have a beautiful smile, and at the same time feel like they're not old looking.
Right. And I mean, it looks to me that, I haven't met a person yet, literally, whether the person is like, let's take 20, and probably applies to 15 and 10 years also, but 20 up and, 58, or whatever I am and stuff. The truth is, we don't mind quite looking our age, but we don't like to look 5 and 10 and 15 years older. Nobody does. Even if we're kind of an old crouch, we still don't like to look even an older crouch, So this looks to me like a major benefit to life, to
right.
To still look, look at the ladies and even guys. I mean, we do all kinds of things to look a little younger, and if a caved in face, basically nulls all what we do outside, every cosmetic, every little wrinkly type of things, because you can't avoid the, so that means a dentist is, again, first you showed us that missing teeth can lead to headaches and to back pains and, shoulder pains and stuff, and maybe even down to back pains. Now you show us that we can look better. You also showed us already that you by gum disease, by avoiding gum disease, that you can raise your immune system, which is major, and maybe avoid,
right.
Heart attacks, strokes, kidney failures, name it, stillborn babies, underweight babies. So it's amazing how much the mouth affects the rest of the body.
It's true. I mean, the first thing you see when you talk to someone is their smile. And that tells you a lot about that person. When they, you can have the most beautiful woman, but if she smiles and she has missing teeth or no teeth or lopsided teeth, you go, whoa, she's a beautiful woman, but God, her smile doesn't fit, so you can do all the cosmetic work you want on Botox and injections and other things, but, when they smile, and if you don't have the right support for your lips, it doesn't matter how much stuff you put in your lips, you're going to have wrinkles, it's going to look sunken, and you're going to look a lot older than you should. And today, there's no reason for that.
I love it. Thank you very much, Dr. Piskin, for letting us
You're
know
welcome.
candidly.
Nice talking to you.